Hey friends! In today's video, we're going to talk about depressive disorders. So the first diagnosis we're going to discuss is a major depressive disorder. It's a mental health condition that's characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities. Depression can also cause physical symptoms such as changes in appetite and sleep, fatigue, and difficulty concentrating. According to the DSM-5, the diagnostic criteria for major depressive disorder includes the presence of at least 5 of the following symptoms during a 2-week period. Persistent feelings of sadness, hopelessness, or emptiness. 2, loss of interest or pleasure in activities that were once previously enjoyed. 3, significant changes in appetite or weight. 4, changes in sleep patterns. 5, changes in activity level. 6, fatigue or loss of energy. 7, feelings of worthlessness or guilt. 8, difficulty concentrating. And 9, recurrent thoughts of death or suicide. To assess for major depressive disorder, a healthcare provider may use a variety of tools, which include structured clinical interviews, self-reported questionnaires, or psychological assessments. These tools can help to determine the presence and severity of symptoms and rule out other potential causes. Pharmacological treatments for major depressive disorder often include antidepressants, such as selective serotonin reuptake inhibitors and tricyclic antidepressants. In some cases, mood stabilizers such as lithium or valproic acid may also be prescribed. In addition to medication, non-pharmacological treatment for major depressive disorder can also be effective. These treatments include psychotherapy, such as cognitive behavioral therapy or interpersonal therapy, as well as lifestyle changes such as regular exercise, good sleep patterns, and a healthy diet. Some interesting facts about major depressive disorder include that it's one of the most common mental health conditions, affecting millions of people worldwide. In addition, depression is also comorbid with other mental health conditions such as anxiety or substance use disorder. Overall, major depressive disorder is a serious condition that can have a significant impact on an individual's quality of life. With proper treatment, however, individuals with depression can improve their symptoms and live fulfilling lives. It's important for individuals with this condition to work closely with healthcare providers to find the right treatment plan. The next diagnosis we're going to talk about is persistent depressive disorder, also known as dysthymia. This is a mental health condition that is characterized by a chronic low mood that lasts for at least 2 years, or 1 year in children or adolescents. Unlike in major depressive disorder, the symptoms of dysthymia are not as severe, but they can still have significant distress and impairment on an individual's ability to function. According to the DSM-5, the diagnostic criteria for persistent depressive disorder includes the presence of a chronic low mood for at least 2 years, or 1 year in children or adolescents, as well as at least 2 additional symptoms of depression, such as changes in appetite or weight, changes in sleep pattern, feelings of worthlessness or guilt, and difficulty concentrating. In addition, the individual must not have any periods of major depression during this time. To assess for persistent depressive disorder, a healthcare provider may use a variety of tools, including structured clinical interviews, self-reported questionnaires, and psychological assessments. These tools can help to determine the presence and severity of symptoms and rule out other potential causes. Pharmacological treatments for persistent depressive disorder often include antidepressants, such as serotonin reuptake inhibitors, SNRIs, and tricyclic antidepressants. In some cases, mood stabilizers such as lithium and valproic acid may be prescribed. In addition to medication, non-pharmacological treatments for persistent depressive disorder can also be effective. These treatments may include psychotherapy, such as cognitive behavioral therapy or interpersonal therapy, as well as lifestyle changes such as regular exercise, a healthy diet, and good sleep habits. Some interesting facts about persistent depressive disorder include that it is more common in women than men, and it often first appears in late teenage years or early adulthood. In addition, individuals with persistent depressive disorder may be at an increased risk for developing major depressive disorder later in life. Overall, persistent depressive disorder is a chronic condition that can be challenging to manage, but with proper treatment, individuals with the condition can improve their symptoms and lead a fulfilling life. It's important for individuals with persistent depressive disorder to work closely with a healthcare provider to find the right treatment plan. The next diagnosis is premenstrual dysphoric disorder, also called PMDD. It's a mental health condition that is characterized by severe emotional and physical symptoms that occur during the premenstrual phase. These symptoms include feelings of sadness, irritability, anxiety, and anger, as well as physical symptoms such as bloating, breast tenderness, and headache. According to the DSM-5, the diagnostic criteria for PMDD includes the presence of at least 5 of the following symptoms during the premenstrual phase of the menstrual cycle. 1. Marked anger or irritability. 2. Marked depression, anxiety, or tension. 3. Persistent and marked difficulty in interpersonal relationships. 4. Persistent and marked difficulty in controlling emotions. 5. Persistent and marked fatigue or lack of energy. 6. Persistent and marked appetite changes or food cravings. 7. Persistent and marked feelings of bloating or swelling. 8. Persistent and marked breast tenderness or swelling. Or 9. Persistent and marked headache or other physical symptoms. To assess for PMDD, a healthcare provider may use a variety of tools, including structured clinical interviews, self-reporting questionnaires, and psychological assessments. These tools can help to determine the presence and severity of symptoms and rule out other potential causes. Pharmacological treatments for PMDD often include antidepressants, such as SSRIs, SNRIs, or tricyclic antidepressants, as well as oral contraceptives. In some cases, nonsteroidal anti-inflammatory drugs, or NSAIDs, may also be prescribed to help with the physical symptoms of PMDD. In addition to medication, non-pharmacological treatments for PMDD can also be effective. These may include psychotherapy, such as cognitive behavioral therapy or interpersonal therapy, as well as lifestyle changes such as regular exercise, good sleep habits, and a healthy diet. Some interesting facts about PMDD include that it's more common in women than in men, obviously, and it often appears during the late teenage years or early adulthood. In addition, PMDD may be difficult to diagnose because its symptoms are similar to those of menstrual-related disorders and other mental health conditions. Overall, PMDD is a complex condition that can be challenging to manage. With proper treatment, however, individuals with PMDD can improve their symptoms and lead fulfilling lives. It is important for individuals with this condition to work closely with a healthcare provider to find the right treatment plan. The next diagnosis we're going to discuss is substance or medication-induced depressive disorder, also known as substance-induced mood disorder. It is a type of mental health condition that is caused by the use of drugs or medication. This condition is characterized by the presence of depressive symptoms such as feelings of sadness, hopelessness, loss of interest in activities, and changes in sleep and appetite. Some substances that can cause substance-induced or medication-induced depressive disorder include alcohol, amphetamines, cocaine, opioids, benzodiazepines, steroids, anticonvulsants, anti-inflammatory medications, antihistamines, and antipsychotic medications. According to the DSM-5, the diagnostic criteria for substance or medication-induced depressive disorder includes the presence of depressed mood or loss of interest or pleasure in activities, along with at least 4 additional symptoms of depression, such as changes in appetite or weight, sleep disturbances, psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or guilt, difficulty thinking or concentrating, recurrent thoughts of death or suicide. These symptoms must be judged to be the direct physiological consequence of substance use or medication, or must be associated with the onset or exacerbation of substance use or medication. There are several assessment tools that can be used to diagnose substance or medication-induced depressive disorder, including structured clinical interviews such as the Structured Clinical Interview for the DSM-5, and self-reported measures such as the Beck Depression Inventory. These tools can help to assess the presence and severity of symptoms of depression, as well as the potential role of substance use or medication in their development. Treatment for substance or medication-induced depression typically involves addressing the underlying substance use or medication, as well as providing pharmacologic and non-pharmacological interventions for the symptoms of depression. This can include medications such as selective serotonin reuptake inhibitors and other antidepressants, as well as psychotherapy such as cognitive behavioral therapy to help individuals identify and change thought patterns and behaviors. Some interesting facts about substance or medication-induced depressive disorder include it's a common complication of substance use and medication that can occur with a wide range of substances, including alcohol, stimulants, opioids, and benzodiazepines. It can develop quickly within a few days or weeks of starting or increasing the use of a substance or medication, or it can develop more gradually over a period of months or years. It can be difficult to distinguish from other types of depression, such as major depressive disorder or persistent depressive disorder, and may require a careful evaluation of the individual's substance use and medication history. It's important to seek treatment for substance or medication-induced depressive disorder, as untreated depression can lead to serious complications such as social isolation, poor performance at work or school, and suicidal thoughts or behaviors. In conclusion, substance or medication-induced depression disorder is a mental health condition that's caused by the use of drugs or medications. It's characterized by the presence of symptoms of depression, such as feelings of sadness, hopelessness, and can be treated with a combination of pharmacologic and non-pharmacologic interventions. It's important to seek treatment for this condition, as untreated depression can lead to serious complications. The next diagnosis we're going to discuss is depressive disorder due to another medical condition, also known as secondary depression. It's a type of depression that is caused by another medical condition. This can include physical health conditions such as chronic pain or heart disease, or mental health conditions such as anxiety. Medical conditions that can lead to depressive disorder due to another medical condition include chronic pain, heart disease, cancer, Parkinson's disease, or HIV and AIDS. It's also important to be aware that certain medications such as corticosteroids and interferon can cause or worsen depression. According to the DSM-5, the diagnostic criteria for depressive disorder due to another medical condition includes having a depressed mood or loss of interest or pleasure in daily activities, and at least 4 additional symptoms, such as changes in appetite or weight, sleep disturbance, low energy or fatigue, feelings of worthlessness or guilt, difficulty thinking or concentrating, or suicidal thoughts or thoughts of death. These symptoms must also be a direct result of the underlying medical condition and not better explained by another mental disorder. To assess for depressive disorder due to another medical condition, healthcare providers may use a variety of tools such as physical assessments, blood tests, psychological evaluations. Some common assessment tools for depression include the Beck Depression Inventory and the Hamilton Depression Rating Scale. Treatment for depressive disorder due to another medical condition often involves a combination of pharmacologic and non-pharmacologic approaches. Common pharmacological treatments for depression include selective serotonin reuptake inhibitors and other antidepressants. Non-pharmacological treatments may include treatments such as cognitive behavioral therapy and lifestyle changes such as regular exercise, good sleep habits, and a healthy diet. It's important to note that depressive disorder due to another medical condition is not the same as having depression in addition to another medical condition. In the case of secondary depression, the depression is directly caused by the underlying medical condition and should be treated accordingly. In conclusion, depressive disorder due to another medical condition is a type of depression that's caused by an underlying medical condition. It's important to be aware of the DSM-5 diagnostic criteria and how to appropriately use assessment tools when evaluating for this disorder. Treatment often involves a combination of pharmacologic and non-pharmacologic approaches, and it's essential to address the underlying medical condition to the depression. The next diagnoses we're going to talk about is other specified depressive disorder, also known as subthreshold depression. It's a type of depression that does not meet the full diagnostic criteria for major depressive disorder. This can occur when individuals experience symptoms of depression, but not enough to diagnose them with major depression, or when their symptoms do not fit the specific pattern outlined in the DSM-5 criteria for depression. According to the DSM-5, the diagnostic criteria for other specified depressive disorders includes having a depressed mood, loss of interest or pleasure in daily activities, and at least 2 additional symptoms, such as changes in appetite or weight, sleep disturbances, low energy or fatigue, feelings of worthlessness or guilt, difficulty thinking or concentrating, or thoughts of death or suicide. However, these symptoms must not meet the criteria for major depressive and must not be better explained by another mental disorder. To assess for other specified depressive disorders, healthcare providers may use a variety of tools such as physical examinations, blood tests, and psychological evaluations. Some common assessment tools for depression include the Beck Depression Inventory and the Hamilton Depression Rating Scale. Treatment for other specified depressive disorder often involves a combination of pharmacologic and non-pharmacological approaches. Common pharmacological treatments for depression include selective serotonin reuptake inhibitors and other antidepressants. Non-pharmacological treatments may include treatments such as cognitive behavioral therapy and lifestyle changes such as regular exercise and a healthy diet. It's important to note that other specified depressive disorder is not the same as having subclinical or mild depression. In the case of other specified depressive disorder, the individual symptoms do not meet the criteria for major depressive disorder and require a specific diagnosis. Some examples of other specified depressive disorders include persistent depressive disorder, formerly known as dysthymia, depression with insufficient symptoms, and depression with mixed features, having both depression and manic or hypomanic symptoms. In conclusion, other specified depressive disorder is a type of depression that does not meet the full criteria for major depressive disorder. It's important to be aware of the DSM-5 diagnostic criteria and to use appropriate assessment tools when evaluating for this disorder. Treatment often involves a combination of pharmacologic and non-pharmacological approaches, and it's essential to provide a specific diagnosis and individualized plan for individuals with other specified depressive disorder. The last diagnoses we're going to discuss for the depressive disorder section is unspecified depressive disorder, also known as unspecified depression. It's a type of depression that does not meet the specific criteria for any other depressive disorder. This can occur when an individual experiences symptoms of depression, but their symptoms do not fit the specific patterns outlined in the DSM-5 criteria for major depression, persistent depression, or other specified depression. According to the DSM-5, the diagnostic criteria for unspecified depressive disorder includes having a depressed mood or loss of interest or pleasure in daily activities, and at least 2 additional symptoms such as changes in appetite, weight, sleep disturbance, low energy, fatigue, feelings of worthlessness or guilt, difficulty thinking or concentrating, or thoughts of death or suicide. However, these symptoms must not meet the criteria for other specified types of depression and must not be better explained by another mental disorder. To assess for unspecified depressive disorder, healthcare providers may use a variety of tools such as physical exams, blood tests, and psychological evaluations. Some common assessment tools for depression include the Beck Depression Inventory and the Hamilton Depression Rating Scale. Treatment for unspecified depressive disorder often involves a combination of pharmacologic and non-pharmacological approaches. Common pharmacological treatments for depression include selective serotonin reuptake inhibitors and other types of antidepressants. Non-pharmacological treatments may include therapy, such as cognitive behavioral therapy, and lifestyle changes, such as regular exercise, good sleep patterns, and a healthy diet. It is important to note that unspecified depressive disorder is not the same as having depression without a specific diagnosis. In the case of unspecified depression, the individual's symptoms do not fit the criteria for other specific types of depression and require general diagnoses of unspecified depression. In conclusion, unspecified depressive disorder is a type of depression that does not fit the specific criteria for other types of depression. It's important to be aware of the DSM-5 diagnostic criteria and to use appropriate assessment tools when evaluating for this disorder. Treatment often involves a combination of pharmacological and non-pharmacological approaches. And it is essential to provide a general diagnosis and an individualized treatment plan for individuals with unspecified depressive disorder. So I hope you guys enjoyed that video about depressive disorders, and I'll see you next time. Bye.